we can see this, what is calcium absorption. So calcium absorption happens in duodenum. Actually, this is a regulated type of absorption. When vitamin vitamin D level rises in body, so it will induce, vitamin B12 is nothing, vitamin D is nothing but it acts as hormone. It induces protein, mRNA and then protein. And it induces which protein? Cal binding protein. So what does this cal binding protein do? The cal binding protein, whatever calcium is absorbed, it will bind this calcium. And that is how actually the concentration of calcium inside the cell will be low, solution concentration, because it is bound to the cell. And that is how calcium absorption is facilitated. And this calcium will be exported out of the cell into the blood vessels through this ATPase. And this is the absorption mechanism. And this is done by, the calcium is already a divalent element. It is done by divalent metal transporter. Okay. Divalent metallic transporters are there. DMTs are there. So through this divalent metallic transporter will transport calcium. And calcium will bind this. So this is the significance of vitamin D. Cal binding is very important. This cal binding is stimulated by vitamin D. So 1/3 of the calcium, net calcium uptake occurs via paracellular route also. So through this cellular route, paracellular. And then 2/3 remaining calcium uptake actively through this. And because this is under regulation of vitamin D, and that is why it can be activated. If our body requires more calcium, it can be activated. Active transport can be activated. This passive will goes on, but it will be activated because of vitamin D. If our body requires more calcium. So this is a calcium ATPase. It requires ATP to pump out calcium to the blood. So this two channel, you can see absorbing channel, and this it will pumping out channel. And this is actually a type of, you can see, secondary type of absorption. This will create vacuum. This cal binding will also create vacuum, and this ATPase will also create vacuum. That is why this calcium will be absorbed here. So this is calcium absorption that happens in mainly duodenum and upper part of jejunum. 30 to 80% of dietary is typically absorbed in duodenum and then upper jejunum. So vitamin B12, vitamin D induces and produces cal binding protein. So you can see deficiency of this vitamin D will, the child known to have hypophosphatemia. On physical examination, the child has bowing of lower extremities and short stature. It is noted that widening gate X-ray has been shown in the figure, which is most probable diagnosis. So most probable diagnosis, you can see, is vitamin D deficiency. This is rickets. And if in children, it is rickets. In adult, it will cause osteomalacia. So this is because of vitamin D deficiency, and vitamin D deficiency, this is how it will cause deficient calcium absorption. If vitamin D is deficient, it will cause deficient calcium absorption and demineralization of bone. Bone will not be mineralized properly, and in baby, it will cause rickets. And in adult, if it happens, it will cause osteomalacia. Bone is very fragile. Pathological fracture will happen.